Thank you, John Edwards and Stace Dollar. We're so glad to have you with us tonight. You've been good friends of ours in the disposal world, and we're grateful to have you with us. What are the most effective means of disposal? We know that DEA take-back days are popular. They've grown in popularity over the last decade. We certainly know that the DEA and FDA recommend that. And that's not always convenient, right? We have folks who live in rural areas where they don't have a take-back day or don't have a kiosk available. We have folks with transportation challenges. But what, in your mind, are the most the best methods of disposal?
There was some recent research within the past 3 years. It was actually studies conducted in the state of Kentucky, in the state in which I live, and they evaluated the Kentucky All-Schedule Prescription Electronic Reporting System, and they noted that opioid take-back events and permanent drug donation boxes only accounted for the return of about 0.3% of the dispensed opioids in those communities in Kentucky where they did this survey. And so these results really suggest that many unused, unaccounted for opioids are left in communities for misuse and diversion when those types of disposal methods are provided. So I think the most convenient method really is the in-home opioid disposal product. So the research showed that providing an in-home opioid disposal product along with education, like Stace talks about, really motivates patients to dispose of unused opioids. So if we think about prior research, has reported baseline rates of opioid disposal when you do nothing, no disposal method, no talk about disposal at all, and no education, no providing anything, 5 to 26% of patients will actually dispose as a baseline rate. But 6 of the studies in my systematic review showed disposal rates, quite above the baseline rate, around 33 to 71%. When in-home opioid disposal products were provided. Now, two of the studies in my systematic review found low rates of disposal, 27% or less. And one of those was a mail-back program. So one of the studies looked at providing patients with a mail-back envelope to send home with their disposal with their opioid medications, and found really that patients in that population really did not use those mail-back envelopes hardly at all. So I think the most beneficial thing and what the studies really support is the provision of an in-home opioid disposal product, safe, convenient, effective.
Can I add to that?
Sure, absolutely.
Carrie? So as John talked about the disposal products, one of my studies found, and it talked about passive versus active education. And I found, as I looked into a lot of my references here in the studies, that one of the common things were that they would just hand patients the instructions, not explaining it, not an active form of education. And their rate of disposal was around 21%. So they were also a very low disposal rate, whereas active education really increased that up into the 70 percentile. But one of the things I found also was about DEA takebacks. And one thing that I kind of picked out of it was that, they only happen twice a year. So you're limited in the amount of times a year you're able to return these opioids. But the other thing is, I found a huge discrepancy in the number of locations per state throughout the United States. I mean, we have one state that actually has one location twice a year.
Right.
And it's, a relatively large state. But, you compare some of the much smaller states that have 220, 240 actual locations. So I think some states have a more of an opportunity for patients to dispose. So
yeah.
While it's a great thing, I think some states are at a bit of disadvantage there.
I would totally agree. We know that to date, right, since our product Dispose RX packets were launched back in 2018, our primary business model, right, those who have been driving this have been the primarily the chain pharmacies. and the engagement, right? So it's part of their opioid stewardship programs, where they provide the packets with opioid prescriptions. And they do mandate as part of their compliance programs that the pharmacists engage with the patients. And going to your point, Stace, we know that that is the most effective, right? To talk about the risks of opioids, to make sure that they are aware of proper storage and disposal. But I wanted to talk with you all, since you both practice at Baptist Health in Lexington as CRNAs. I wanted to talk with you about how you think hospitals and providers can do more to facilitate this education. Your hospital, right, and several within the Baptist Health System, they do have active opioid stewardship programs. You are talking about disposal in different ways. But I just wanted to, since you've studied this, what do you think are some of the best practices, some of the things that hospitals and providers can do to help with this initiative and get engaged?
Well, you mind if I take this, John?
Yeah, go ahead,
All
Stace.
right. You know, and John could add to this, but I think while we have a pharmacy that provides the in-home disposal product with the opioids that are prescribed to the patients leaving the hospital, and the pharmacy technicians do a great job with educating patients, I still think that there's a need to where this education needs to be an active form of education, and it needs to start in the surgeon's office. And those things we talked about earlier, what is the patient's expectations? What are the pain expectations? How are we planning on managing your pain? But at the same time, that needs to be carried through every phase of care. So from the time the surgery is scheduled through discharge, and the message needs to be the same. And disposal really needs to be a big part of that. And, demonstrating how to dispose, not only verbal education, but maybe a little video that demonstrates how to use the in-home disposal product.
I love that idea. John, anything you want to add?
Yeah, one of the things that, Stace and I, published in different journals, and one of the things that I wanted to do with the Journal of Nursing Administration was to really kind of challenge healthcare administrators, to think differently about this process, because, the pharmacies that, as you shared, are, doing a great job on the pharmacy end. But, what if we can create a culture within our healthcare facilities that the concept of, safe opioid use, storage, and disposal kind of becomes commonplace, and so I wanted to challenge healthcare administrators with mine. So I really developed some, recommendations for practice for the healthcare facilities. And, number one, the most important thing is that, I believe healthcare facilities should find some way to provide patients with an in-home opioid disposal product, such as a Disposer-X packet, upon discharge from the hospital with every filled opioid prescription. And then, as Stace was saying, really education on the safe use, the safe storage, and how to dispose of these unused opioids in an active form is very important. And then a couple of more points would be, providing a one-on-one consultation with a healthcare provider preoperatively, like Stace was mentioning, in the surgeon's office, in the pre-admission testing phase of care, even in the preoperative room prior to surgery. But a consultation with a healthcare provider about what to do with unused opioids postoperatively, specifically addressing disposal. And then finally, I think a big piece to kind of circle back on everything is that at that postoperative follow-up visit, there needs to be a plan implemented by a healthcare provider to address, unused opioids and have patients dispose. And that can be as simple as, the physician or the surgeon who's seeing that patient back in the office at their 2 or 3 week follow-up visit, or the nurse who's checking that patient in, asking them about, we sent you home with 15 opioid pills, did you dispose of the unused ones? If not, how can we help facilitate that? So I think those are the really important things, and the thing that we can challenge healthcare facilities with.
Yeah, so that's what the Shriners study showed, right? So they actually, in their pediatric orthopedic department, they had the anesthesiologist do the consult, preoperative consult. And then they did follow up at the 1 week mark, right, at the first post-op visit, and then the 2 weeks later. So, and they got great results, obviously. I wanted to touch quickly on what you think are the greatest hurdles. We certainly know what we hear when we talk with folks out in the field, but what do you hear from patients are the greatest hurdles, the reasons they do not want to dispose of their leftover opioids or other medications?
Well, I think the reason people don't dispose of their medications, the most common thing is fear of future pain. And that is one thing that I think would be something that would be great to study is why are people holding on to these? I think people who have had severe pain in the past are afraid that they're going to have this pain again. They're going to not be prescribed the opioids, or simply they've paid for the opioids already and it would be wasting money. But I think the biggest thing is fear of future pain.
That's right.
Yeah, I would agree. We certainly hear that. So moving on, shifting gears a little bit, how important do you think that disposal is as part of opioid prevention efforts? We know a lot of attention is placed on treatment of substance use disorders or opioid use disorders. A lot is focus is put on recovery, as it should be. We're not disputing that, but we of course talk a lot about prevention, making sure that new addictions do not start, that there's not misuse of the medications in the medicine cabinet, if you will. What do you think is the part of disposal? What part does disposal play in prevention?
Yeah, I think, as Stace and I, as, anesthesia providers and acute surgical pain management experts, one of the things that I think about often is that, gosh, the opioid epidemic is just a huge thing. And I have such a heart for folks who have developed opioid use disorders and the struggles that they have. And it can be kind of overwhelming in the scope. But I think, what can Stace and I do? What can healthcare facilities do on the preventative side to help improve the health of their communities? And so for us, that is managing acute surgical pain well. And then providing a way for patients to, reduce the amount of opioids that they need, reduce the amount of opioid prescriptions that they take home, and then find a safe way to store those and dispose of those so that we can reduce the community supply of opioids and also reduce the misuse of opioids, by patients post-operatively. And I think really the authors of that recently published article in The Lancet entitled "Responding to the Opioid Crisis of North America and Beyond," to the Stanford Lancet Commission, they estimated something that is interesting. They estimated that without new action or initiatives to address the opioid epidemic, the next decade is going to bring 1.22 million deaths, or an average of 336 people dying every day from an opioid overdose. And if you read the opioid literature over the past 3 or 4 years, it's always quoted 130 people die a day from an opioid overdose. Now we're talking 250 or 60 people would die a day in 2022 from an overdose. But we're talking over the next decade, that number could escalate to 336 people a day without new initiatives, right? So, these authors really felt and discussed that the prevention of new cases of opioid addiction is essential. Therefore, they strongly recommend that the U.S. adopt methods to facilitate the disposal of billions of excess pills in our households, the community supply that I just mentioned. And according to the Lancet Commission, the disposal of leftover opioids in communities can create healthier environments and help produce long-term declines in the incidence of opioid epidemic. And that really is where we are living right now on our side. And it's that preventative piece.
Okay, the last question I'm going to ask about, you touched a little bit about your efforts as CRNAs and providers of anesthesia. You both are engaged in opioid alternative therapies for pain management at Baptist Health. How accepting are patients of alternative therapies? And how are you seeing other providers jumping on that bandwagon and and embracing the idea of alternatives?
So as John said, with our acute pain service, we provide acute, management of acute surgical pain. So we're providing numerous nerve blocks, nerve catheters, A lot of our patients are going home with nerve catheters that are lasting anywhere between 3 to 5 days, 4 to 6 days, and managing their pain well. Some of the newer things that we've started are some cryoneurolysis, and we didn't know how well that would take off, but it is a great therapy. The patients are very receptive to it, and word has kind of spread. And so we find that we are having patients that are calling us back saying, can you treat my other knee? Can you, do this for me? Or I've had a friend that's had this treatment. Is there any way that you can provide that treatment to me? So even though we're relatively new in the cryoneurolysis side of it, we're having patients reach out to us. So they're very receptive of these different techniques to manage their pain.
Yeah, and I think, if we think historically, Stace and I have been practicing nearly 20 years now, and specifically practicing in acute surgical pain management for 12 or so. And, when we first kind of got into this, the first year we kind of developed this acute pain service, we did 800 nerve blocks a year, and probably 100 of those were nerve catheters. Now we provide nearly 5,500 nerve blocks and 2,500 catheters annually for patients within our facility. And, we find that patients are very receptive to it because, the word is out, it's all over the news media, and patients will say to us often, look, I don't want to take many of those opioids. I don't want to get addicted. Somebody in my community had that, a family member, died of an opioid overdose, these type things. And so people are generally, concerned about opioid abuse and opioid addiction, and they've seen it in their communities, especially in our state. And they're very receptive and open to, non-opioid techniques and even non-pharmacologic techniques to manage their pain.
And I think we can add to that, John, about not just the patients, but as the providers, all of our surgeons have really jumped on this whole multimodal technique and, how we manage pain to decrease the amount of narcotics the patients receive. And not just the surgeons, but hospitalists in our facility, the ER physicians in our facility. I mean, so the providers in our facility have really jumped on the bandwagon, as you asked. And we find that the narcotic usage and the narcotics that are sent out the door from our facility are decreased with all of that.
That's right.
Which is what we want. Yeah.
Yep.
That's fantastic. Okay. Is there anything else that you want to touch on tonight before we complete the interview?
I think the thing that I would lastly like to say is, when I was growing up in the 80s, and, we would jump into a car and go somewhere, and we often wouldn't think to put a seatbelt on. And, now in 2022, I don't even back out of my garage without my seatbelt on because it's become an expected behavior, in our society. And I would love to see the next, generation of people, my kids and their kids realize that, hey, when you have, opioids to help manage pain, which are important, they're an important part of the pain management process. But when you're finished with those medications, there are a danger in those. They, something that you can misuse, they can be diverted into our communities. We must dispose of those effectively and properly, as soon as we possibly can. So I would love to see, opioid disposal become an expected behavior, much like wearing a seatbelt in a vehicle.
Fantastic. Well, I cannot thank you enough, Dr. John Edwards and Dr. Stace Dollar. Thank you for continuing your good work. Thank you for your research, and thank you for being champions of ours and the whole disposal message. So take care, and thanks again.
Thank you,
Carol.